And you know what? Do you know what, Namtika? The biggest thing is that many people will think that when they test positive that it's the end of the world, but it really isn't.
Yeah.
And it's important that we are aware that actually, technology has advanced so much that we can actually live a full life. And so when you test HIV positive, there's a lot of stigma obviously in the family, and there's a lot of, you decide how you want to, who you want to know, you decide what it is who you want to know and who you want to disclose to. And that's important.
Do I have to disclose to my partner if they're HIV negative?
I think it's important. I think partners are important to be included in the conversation, especially if you're going to continue having sex with them.
Absolutely.
That's the important thing. But for every relationship, I think it's important. If your relationship is based on trust, and if it's based on openness, and it's also this understanding that, someone must have gotten it, and it must have, someone brought it into the relationship, or someone came with it into the relationship. And that's important. That's okay. That's okay.
Yeah.
It's okay. We have different sexual histories. We have different ways of being in the world.
Yeah.
And we have different things that we come into a relationship with. So that's why it's so important for us to emphasize prevention.
Yeah.
But when we test positive, what do we then do? What happens? So what usually will happen at the clinic is that you will then have to go for you'll have multiple tests, but two very important tests is your CD4 count test to show to show your resistance, and that's basically to show your CD4 count, to be able to understand your number of T helper cells. Okay, so basically, the lower your CD4 count is, the more you are prone or susceptible to developing opportunistic infections like TB. Okay, and usually TB lowers that CD4 count even more.
Yeah, so I'm thinking now, completely, and I'm thinking now, into a CD4 count, it basically just means ijonga but i-virus active kangakanani emzimbeni wakho, and that these cells ezincedayo ezijonga amasotsha womzimba, ezijonga immune system yakho, zi-active kangakanani. And I think that usually then determines sort of your state, and the lower it goes and the higher the viral load. Yes. So I understand.
So the second one, mentioning the viral load, the second important test is the viral load. And dit wys jou hoeveel virus daar in jou bloed is. So that then this is how much virus is actually in your blood.
Yes.
And so how active, again, like you mentioned, how active the virus actually is in your system.
Yeah.
And so what the ARV treatment does, so when you then initiate ARV treatment, so when you start the treatment process, what the treatment does is stop the replication of the HIV in your body.
So replication.
So that your body can build resistance. So dat nie meer HIV virus in jou bloed kan wees nie. So dit stop. Want die virus multiply, dit vermeer.
So as by HIV is spread emzimbeni wakho, is spread ngoba is phinde cells zayo.
Yes.
Is it correct to say it like that?
Yeah.
So ke ngoku it helps ARVs is stop lando yoba ibe is phinde. So for example, it stops la replication, which means it sort of i-virus isekhona emzimbeni wakho, but ayizoba busy kakhulu, and spreading that one particular one because ibanjwe i-ARV.
So that's quite important to know, because what the ARV treatment does is then prevent you from actually from the HIV developing into an AIDS syndrome.
Yeah, because it protects the immune system.
Yes. And usually what will happen is that when you go to the clinic, many people wait for them to get sick. So they wait for, instead of testing frequently, they would rather test when they're actually experiencing TB symptoms.
Yeah.
So when you get to the clinic, already your immune system has been so compromised dat jy nou hoes en jy het night sweat en jy het al klaar TB. So wat dan moet gebeur, dan moet jy eers TB treatment begin voor die ARV treatment kan begin. En dit is baie moeilik om TB op te tel in mense met HIV positive. And so it's very difficult to actually pick up TB in people who are HIV positive. And that's why you always have to test when you go to the clinic and you go for TB symptoms and you screen for TB and you have a TB test and TB test is positive. It's important that you do the HIV test. And that's why we emphasize that individuals must go for the HIV test to be able to intensify the TB testing.
So what I like about Intulans or Tetanayone is the fact that you mentioned ARVs, the fact that they stop blood replication.
Yes.
That we spoke about.
Yeah.
Now, can we talk about the importance adherence, which means so every day or 6, for example, and why it is important for us to make sure that you know, if we're HIV positive, you adhere to treatment. And
so dit is belangrik dat mense moet 'n gesonde leefstyl hê en jy moet altyd jou medikasie gebruik. So elke dag, so every day you must be taking the way it is prescribed to you, the way the sister at the clinic or the nurse at the clinic or the doctor at the clinic, that the GP will explain to you how to take it. And it's so important to be adherent because some people might experience side effects. Nothing wrong with side effects. We use different levels.
It's also about how we are being counseled in getting side effects.
Yes.
Because a lot of the times abantu they stop using something because I could write for
yes.
But it's because a lot of the times when we give any medication or any information around the health yet and what we need to do, we are not usually told the side effects and how we deal with them. And how's experience and you still feel like you're panicking. Sometimes you go and see your consult because again it goes back to SR stigma and the fact that you're going to be shouted at because then you're HIV positive because you had sex, which you were not. So it becomes a whole thing. So they end up adhering sometimes in side effects.
And
so it's important what you're saying.
And it's important for you as the individual who is HIV positive to really take control. It's really not an easy journey to be diagnosed with HIV because you're thinking about, you know, what the broad implications are for your family, who's going to reject you, who's going to accept you. But it's a process. And so it's important for you to understand that when you do get your positive result, that you do then start your HIV, your ARV treatment
that we spoke about.
Yes.
And agency.
Yes. And you try and
find,
and you're still a sexual being, you're still going to have sex. And it's important for you to be able to, first of all, track your sexual partners. I think that's for me the most important thing. Find out who you might have, who might be HIV positive and don't know that they're HIV positive. You know, so be understanding that, you know, your sexual partners and all of them had
it's different, I mean,
some played a role,
Yes, absolutely.
And for some people it's easier to track their partners, for others it isn't.
For some people who are in constant contact with their sexual partner. So maybe it could be someone who is your boyfriend or your partner, or someone that you just have a pure sexual relationship with, whether it's a man, whether it's a woman, and whether you're a man or you're a woman. Sometimes it becomes easier, but then for abanye abantu, it may not necessarily be that easy. So sometimes you meet someone at a party, you have sex at one time, and you get infected
and you don't
because
know,
maybe
you contract them,
a female condom and they didn't know how to properly use a male condom, and so you won't be able to track alone. Sometimes with clients, for example, for sex workers, I'm just thinking it might happen that a client is not necessarily someone that some of them are, but maybe for some, I'm going to do that you're constantly in communication with. So then will mean that you won't necessarily be able to track them. But there are cases where you can, and if you can, and you have it's good and I guess encouraged and advised to make contact with that person and say, hey, tested positive when you are ready to disclose.
Yes.
And I positive, and I think because now we have maybe had unprotected sex, or maybe the last time we did it wasn't protected, and I think you may be infected. So maybe go so that you can look after yourself, and if this is your life partner, then maybe so that's ARV treatments, and it's important. I mean, the most important thing is that you constantly there's a whole process that when you visit the clinic that will be explained to you, and it's important for nurses to understand, and this is probably where we start engaging in the discussion about what's nurses, health professionals, teachers, what are our roles as people who are actually serving different people in our community. Absolutely.
What's our role in knowing because we come with ideas about what sex is. We come with very personal values
and the ideas there too
about different ideas, and we come with different judgments almost. We make judgments about other people and how sex ons veroordeel baie mense. En baie van meeste van die tyd is ons ook baie affekteer die dinge. Miskien is dit persoonlik, want no one is safe, completely safe from being HIV positive.
Absolutely.
You can be married and still be at risk of HIV.
Everyone.
Even if you have one sexual partner, because you don't know who that sexual partner might be having sex with, or with what sexual history they are coming in with into your relationship. So don't ever underestimate the extent to which you are exposed or your susceptibility to HIV and AIDS.
And as I think you mentioned, it's important regardless of who you are, regardless of your class status, because there's times where abanyabantu they think they are less likely to get HIV because you're at a certain
because you're a specific race in South Africa. You think that it's only a particular race that will have that will be exposed to HIV. HIV does not discriminate.
It does not. I'm sorry.
Anyone and everyone can be
even the
exposed
healthcare workers themselves
can be exposed to HIV.
Police officers, and some of the risks that are involved. They are also no one is really safe from it. And Nati, sitting here with all this knowledge that we have, and all of this that we're trying to have a conversation about and share now, it still does not necessarily mean that we are safe from it tonight.
So what does this care mean for health workers, for teachers? How do we address this conversation with different people in our communities to talk about this issue, especially when someone is coming in? I go to the clinic and I for example go to the clinic and I have symptoms of an STI. How do I actually go about, as a health professional, to treat that patient, to understand what it is that I can meet their needs, and how do I understand what mustn't I take for granted? So what are our key tips?
So I'm thinking beyond everything, the one thing that is most important, and we spoke about this a lot, is around sex positivity. Yes. And by sex positivity, I'm not saying tell everyone to go and have sex. But if you work with people that come to you and tell you that they are having sex, who they're having sex with, that is not your business. Partially the fact that they have sex in some way, so how they are having sex is a conversation that you need to have with them openly, freely. And I think it would be nice and interesting to actually have someone take interest in the pleasure aspect, understanding your body, understanding, especially if we're a healthcare worker, understanding whether or not this person understands their body. And so having your conversations, basic things like your condom use. So if I walk into a clinic, because I think this conversation is leading us to what is our ideal, because I've heard so many things. I've heard people talking about youth-friendly clinics. I've had people talking about being inclusive. I've had people talking a lot about addressing the fact that as people we do not live single issue lives. As a sex worker, I am also a mother, and I also have a day job actually. Sometimes I do my work during the day, but sometimes I'm at another office. And so when I go to the clinic and I get there and I say, hey, my client raped me, for example, and I need help with ABC. I think it's very important for us to not focus on the fact that I deter my client, which means he's a sex worker, which means because then it's problematic. I am problematizing the fact that you're a woman with agency, because obviously sex work is by choice. Sex workers that are we're talking about sex workers who are sex workers by choice, and this is something that they want, and this is something that they do because for them and we have to respect that.
And not to project your own values onto your clients, and I think that's so important. And as a health professional, to maintain and contract confidentiality, to say that this information that you're sharing with me is confidential, and to hone that into your in the community. Don't talk about people's lives. Don't talk about the fact that someone is HIV positive to your family members. Be confidential in the work that you are doing. And also don't assume that people are what they present they are. If I walk into the clinic and I am coming with a particular symptom, don't assume that I'm just having heterosexual sex. Don't assume that everyone has heterosexual sex. People that are heterosexual presenting, people who present as you can walk into the clinic and you might identify yourself as a man. Understand what people's pronouns are. Understand what people identify as the biological sex, because people might just, I can just come into the clinic and say, hey, I'm a woman, so treat me as a woman. And so it's important to understand your client, understand the individual client, and understand the individual and their lives, and they are human.
And the fact that they've got the right to access that healthcare, but it has to be quality care. It has to be it has to be holistic care.
Yes.
And it has to acknowledge the fact that you are a human being with a right that I need to respect because I have that duty in this space.
Yeah. And just because you have religious ideas or particular ideas about things, don't use that in your practice.
Yeah.
Because in many ways, I mean, it will help you in positive ways because, I mean, it's altruistic to be giving help.
Yes.
And that comes from many religions really kind of encourage people to help others. But you must also draw on the fact that if you are judging your clients based on your religious ideas, that is a flaw, inevitable. That is so problematic.
And I think it's also with that and personal views and all of that. Also look at the implications. So iziphumo zalento yenzayo. If, for example, because a lot of the time sex workers experience condoms zabo being confiscated because sex work is decriminalized.
Yes.
I mean, sorry,
so
sex
it's
work is criminalized.
So you can go to jail for selling sex.
Exactly.
In South Africa.
And so it becomes a problem where if I am a woman and I am walking at night and I'm carrying condoms and then you confiscate them as evidence that I'm a sex worker. On a lot of ways, that is very problematic because if you see a man walking in the streets with a condom at night in the same area, it's less likely that their condoms will be confiscated.
Yes.
So there's that issue, just the gender dynamic in jail alone. And then there's the issue of, okay, fine, I am a sex worker and I'm carrying as condoms and I'm walking in the street. You confiscate them. That is the biggest barrier of the access because I was able to access these condoms and I can speak to my client and my clients know that this is not a favor. I'm here, these are my conditions, I'm going to use a condom. You come and you confiscate that. I don't have any other form of protection except for a condom. So if I get infected, it stems from the fact that you took from me something that may have prevented me from getting infected.